The COVID-19 pandemic is accelerating. It took 67 days from the first reported case to reach first 100k cases. But just 11 days for the second 100k cases and just 4 days for the third 100k cases. The deadly virus, which appears to have originated in an illegal wildlife market in Wuhan city of China, has now spread to 194 countries and territories all over the world. To know the current status of the spread and how dangerous this virus is and also the precautions to be taken, please watch this video till the end. Trust me, this is going to be really helpful, so please do watch this video till the end. And before we begin, please do subscribe to our channel. After being first reported in Wuhan, which was the epicenter, infections were confirmed in several cities throughout mainland China in just a few days after the virus was identified. After that, the authorities in China had placed at least 20 cities on lockdown as they battled to contain the spread. This continued for several days, and finally, China has recently not reported any new locally transmitted coronavirus cases for the first time since the pandemic began, making a major turning point in the global battle to contain COVID-19. About 96% of the patients have recovered and been discharged in China. The country's response to the virus has included strict social distancing, which is really one of the effective precautionary measures, and also extensive public monitoring of citizens as well as various methods of punishment and rewards to encourage adherence to such measures. Chinese government developed a color-coded health rating system which assigns 3 colors to people, green, yellow and red, on the basis of their travel and medical histories, which decides whether a person should be quarantined or allowed in public places based on the color code. The disease is spreading rapidly across the globe. The rapid spread of the coronavirus shows no signs of stopping as the number of cases overseas rises every day. The global infection rate continues to accelerate, with countries across multiple continents now grappling with fast expanding outbreaks of their own. About 85% of total confirmed cases have recovered globally and 15% of deaths reported. Out of the total active cases, 96% of the cases are in mild condition and 4% is critical. China, Italy, Spain, Germany, United States of America, France, South Korea, Switzerland and the UK are the countries that are worst hit by the virus. Netherlands, Austria, Norway, Belgium and Sweden are the 5 European countries have been witnessing an increase in COVID-19 cases. Italy stands the most affected country in Europe as well as outside Asia. The coronavirus outbreak in the country has hit a tragic milestone as it has witnessed the highest number of deaths due to COVID-19 in the world, surpassing China. The government of Italy imposed a national quarantine restricting the movement of the population. Travel to and from Italy during the breakdown has been traced to have caused the COVID-19 spread. Just over a month after the hardest hit Lombardy region confirmed its first case of COVID-19, thousands of Italians tested positive for coronavirus and thousands of deaths are reported as well. Iran is believed to be another country from where the virus is spread to the rest of the world. Many countries have traced their coronavirus patients to have contracted the disease during the travel to Iran. Coronavirus cases rise to tens of thousands in Iran, forcing travel restrictions as well. The health ministry said that for every 10 minutes, one person dies from the virus. The country announced the temporary release of around 70,000 prisoners as a precaution. The situation in the US is grim with the cases and deaths rising. America is actually adding cases at a faster pace than Italy did in the first days of its outbreak. It just took 16 days from the number of cases in America to grow from 100 to 10,000. Millions of people in at least 8 states have been asked to stay home to prevent further spread of the virus. Spain, Germany, France, South Korea are also knocked down by this deadly virus. Malaysia, Indonesia, Thailand, Myanmar, Philippines, Singapore, India, Iraq, Japan, Hong Kong, Pakistan, Russia, Saudi Arabia, Bangladesh and Vietnam are few Asian countries hit by the virus. The spread of the virus has been divided into 4 stages, out of which the first stage is imported cases stage, where people from affected countries carry the virus to their places. The stage 2 is local transmission stage, in which people come in direct contact with the people in the first stage and get affected. The third stage is community transmission stage, in which several people coming into direct and indirect contact with people from the second stage get affected. And the fourth stage is the epidemic stage, which is the last stage, China being an example for the stage. You must be thinking, how does this virus actually spread? The virus is spread through droplets when a person with COVID-19 coughs or sneezes. The droplets land on the surfaces and are picked up on the hands of others and spread further. The virus can cause severe problems including pneumonia and shortness of breath. For about 5% of patients, the condition has been critical, leading to respiratory failure, septic shock, and multiple organ failure and even death. The common symptoms of this infection are respiratory symptoms, fever, cough, shortness of breath, and breathing difficulties. In more severe cases, the infection can cause pneumonia, severe acute respiratory syndrome, kidney failure, and even death. Symptoms of COVID-19 may appear in as few as 2 days or as long as 14 days, during which the virus is contagious but the patient does not display any symptoms. Standard recommendations by the World Health Organization to prevent infection spread include regular hand washing with soap or alcohol-based sanitizer, covering mouth and nose when coughing and sneezing, avoiding close contact with anyone showing symptoms of respiratory illness such as coughing and sneezing, maintain social distancing and avoid touching face, eyes and mouth with unwashed hands. So that's all for today, guys. Thank you so much for watching FanDesi. I hope you liked this video and understood the deadliness of this novel coronavirus disease. So please do take care and report to the nearest health centers in case of any flu-like symptoms. If you really like this video, please hit the like button and subscribe to our channel for more interesting videos. We'll meet very soon. Until then, stay home and stay safe.